When we think about low back pain, the thing that instantly pops to many people's minds is disc. Oh, I have a herniated disc, I have degenerative disc disease, I have arthritis in my back, the doctors told me there was nothing to do but surgery or to put steroids in. Well, I'm here to tell you that in some cases that's true, but in many cases we can help patients that have low back pain without steroid shots and without surgery. And I'd like to tell you a little bit about how we do that. Oftentimes, even if somebody has degeneration in the back, they have arthritis in the back, maybe they even do have some disc disease, oftentimes a lot of their pain is still coming from these other structures in the back, the ligaments and the muscles in particular. When the ligaments get weak, we get a little more motion between the bones than we should. Why do the ligaments get weak? Part of it is degeneration. Part of it is, as you know, many people in our society are overweight. It's a constant strain and pull. The ligaments never get a chance to rest. They never heal. It's injuries, it's car accidents, it's sports injuries, it's CrossFit injuries. All of these things stretch the ligaments and we never properly rehabilitate them. So what happens is over time, one, these ligaments can cause pain on their own, but number two, and perhaps more importantly, is they don't stabilize the joints as they should. Remember, your joints are where two bones come together, and we want those joints to be able to move, but oftentimes what happens is we get too much motion. When we get too much motion in those joints, then our muscles compensate, our muscles get tight. Think about how strong the muscles are in your low back. Those are big muscles, so when they get tight to stabilize structures that can't be stabilized, they hurt. They chronically hurt. These are patients that we see, they go to the chiropractor, they feel good for a day and the pain comes back. They go to the massage therapist, it feels good for 20, 30 minutes, maybe a day or two, and the pain comes right back. These patients are getting relief because somebody is working on the joint and working on the muscle, but they're not stabilizing the joint permanently. And how do we do that without surgery and steroids? Well, we do that by helping your body help itself. We have two primary forms of injections that we use in regenerative medicine. The first is called PROLOTHERAPY, which is where we use dextrose, which is a corn extract. It's a form of sugar that we inject into those damaged ligaments. Say, what is that going to do? Well, sugar should be inside your bloodstream, not out in your tissues. When we put it in the tissues, it opens up some of the cells, it damages them. What this does is this causes your immune system to come into the area. The area does swell up, gets a little tender, but your immune system then starts breaking down that damaged tissue. But in addition to breaking down the damaged tissue, it stimulates your body to start regenerating new tissue. It actually helps your body regenerate those damaged ligaments. The other form of injection that we use is called platelet-rich plasma. You may have heard about this. Tiger Woods has had it. Many NFL players get it. And in this case, we draw out your blood, we extract out the platelets and the growth factors, and we inject those into the damaged ligaments. This increases the blood flow, it attracts your own natural stem cells to the area, it puts all of the growth factors and healing factors in your blood right in those tissues and stimulates your body to regrow and strengthen those damaged ligaments. So what we do is when we find a patient that really needs this treatment, we first look and make sure the patient is healthy enough. Because remember, we're helping your body help itself. We're not cutting anything out. We're not adding steroids. We are trying to help your body help itself. So we have to make sure that you're healthy. So we check blood work. We make sure that everything's balanced and optimized. Then in addition to that, we also do osteopathic manipulation, gentle hands-on work to make sure that your body is lined up and working properly. Some patients benefit from acupuncture. Acupuncture, we know, helps nerve conduction, it helps treat pain, helps the biochemical reactions that happen inside the brain. But in addition to that, it also brings blood flow to the area. It helps bring that nourishment, because remember, the blood is what actually helps promote the healing. It's what brings your immune system in. It's what helps your body heal and recover. And so when we do regenerative injections, we always want to make sure that, one, we're making sure that you're healthy enough to get a good outcome. We want to make sure that we have your body working as it should. We do that with osteopathic manipulation and then sometimes with acupuncture, and that leads to really good results. With low back pain patients, oftentimes we need to treat the area 3-4 times, sometimes more, and some patients actually less. So if you're suffering from low back pain and you're wanting to avoid surgery and you're wanting to avoid more steroid shots into your spine, this could be a good treatment option for you.